Before we talk about any device or serum or protocol, I want to start with the science. Because if you understand what microneedling is actually doing inside your skin, every other decision you make, what tool to use, how deep to go, what to put on afterward, starts to make a lot more sense. I am a retired surgeon. I am not your doctor. What I am is someone who spent years in an operating room and then years running a medical spa where I performed and oversaw skin procedures. And then I started doing this on myself at home. So I am going to talk to you the way I would want someone to talk to me. Read the disclaimer on screen. Please take it seriously. Your skin is the largest organ you have, and it has one very well-developed skill, repairing itself after injury. Microneedling hijacks that skill deliberately. When a fine needle punctures your skin, it creates what we call a microchannel, a microscopic, precisely placed wound. Your body cannot tell the difference between an accidental wound and an intentional one. It sees damage and it mobilizes. Here is what happens. First, the inflammatory phase. Reparative cells rush to the site. Growth factors are released. The area turns red. This is not a bad sign. This is your immune system doing its job. Second, the proliferative phase. Fibroblasts in the dermis, the deeper layer of skin, start synthesizing new collagen and elastin. These are the structural proteins that give skin its firmness and elasticity. Third, the remodeling phase. Over weeks and months, that new collagen organizes itself, and you begin to see the improvements: smoother texture, reduced fine lines, more even pigmentation. This is essentially the same mechanism that makes you stronger after lifting weights. You create controlled microdamage. The body rebuilds better than before. Here is something most people do not appreciate about skin. It is designed to keep things out. The outermost layer, the stratum corneum, is a dense, waxy barrier. Most topical skincare products sit on this layer and never make meaningful contact with the living cells beneath it. The cosmetics industry has spent decades trying to engineer around this problem. Microneedling solves it mechanically. By creating microchannels, you temporarily bypass the stratum corneum entirely. Active ingredients can now reach the dermis, where the blood vessels are, where the fibroblasts are, where they can actually be utilized. The window is short, maybe 30 to 60 minutes before those channels close, but the difference in bioavailability is dramatic. This is why what you apply after microneedling is not a minor consideration. It is a major part of the protocol. Microneedling is not just a skin procedure. For people dealing with hair thinning or hair loss, it is also a scalp treatment. Stem cells that govern hair growth live in the hair follicle bulge region. Microneedling is thought to activate those stem cells directly, increase blood flow to the follicle, and enhance the delivery of growth factors. It can also improve penetration of topical hair loss medications like minoxidil. Think of it as a stimulant. It may improve the quality and thickness of the hair you currently have. It is not a replacement for medications that prevent further genetic hair loss. Next episode, we are going to talk about the tools, dermarollers versus automated pen devices, needle materials, what FDA classification actually means, and how to evaluate what you are buying online. See you there. Explore microneedling devices and serums at unbedsidemanners.com.